protection regulation in Horizon 2020 projects. I would like to say a few words about the project in which frame this webinar is taking place, which is the Health NCP Network 2.0. It's the second edition. This is a coordination and support action, also funded by the European Union, managed by the European Commission, and under the first Health Demographic Change and Wellbeing Call in 2014. And so we have been running for a number of years. We have been running already since beginning of 2015, and we will be running until the end of this year. And the objective of our project is to give national contact points for health, demographic change, and well-being, the means, the skills, and the knowledge on the Horizon 2020 program, specifically in health. And we do this by a number of activities. So we work with three main target groups. We work basically with the health NCP community. So this is work that applicants normally don't see. This happens in the background, and this is about training courses. This is about meet and staff exchanges between NCPs, so that people can exchange the ways they work. They can identify best practices, and so that all NCPs have kind of like the same level of knowledge, and they can provide a similar level of service across the European Union. So this is what you don't see normally. We also work with the applicants, and with the applicants, the only activities that we open are webinars like the one that is taking place today, but also brokerage events, which are meant to help applicants to meet other possible people with whom collaborate and submit proposals together for the SC1 topics. And then we also work with the European Commission. We provide them a lot of feedback on all the experience that we get from assisting applicants, right, in everything that has to do with implementation aspects of the calls. I would like to say, because I've mentioned the brokerage events, that we will be doing one which hasn't yet been announced, and it will take place on, but I can tell you now, we will be sending a save the date soon. It is taking place on the 4th of July in Brussels, and it will be the day after the Commission Info Day. Okay, and this will be specific for the health, demographic change, and well-being calls of the last work program of Horizon 2020, the 2020 calls. This is our website. We have a number of information which is very relevant to you, especially on the tab of events and calls, where we collect all sort of events health related. Also collect different calls, Horizon 2020, and also IMI, EDCTP, AAL, also of other relevant programs which are under the umbrella of Horizon 2020. And we have another tab with the funding opportunities, so you can stay tuned on our website. This is giving you an image of what it looks like. And we also have a Twitter account where you can follow us. And by the way, on our website, we have recordings of our previous webinars that you can listen to. We recently organized one on the different opportunities for European researchers in the NIH, for instance. And there's a number of other webinars recorded. And now back to today's topic, where we, well, not we, but we have a presenter from the European Commission, Albena Kuyubtsieva. Sorry for the pronunciation, but I'm sure she's used to not having her name pronounced correctly. Well, she's program manager, and she's also dealing with the research and ethics review at the DG Research and Innovation of the European Commission. So I will give the floor to her.
Okay. Good morning, everyone. My name is Albena Kuyumjieva, and I will have the pleasure to discuss with you and guide you today on the implications of General Data Protection Regulation on the ethics review process. I'm representing the Ethics and Research Integrity sector of DG Research and Innovation. We are responsible for the ethics review process and defining the ethics policy for Horizon 2020 projects. So I will try to guide you through the main concepts of GDPR and the main approaches, the differences between the regulation and the previous directive. Then I will focus on the main issues, ethics issues in data protection compliance that we encounter during the ethics review process. And finally, I will guide you through the new ethics requirements related to data processing for all Horizon 2020 and Horizon Europe projects. So when we are talking about GDPR, there is a lot of discussions on we have a new regulation now. It is extremely unknown what we should do, how shall we comply with it, and etc. But when we are talking about GDPR, we are not talking about data protection revolution, but we are talking about data protection evolution. The principles that are embedded in GDPR are pretty stable. They have been there for the last 35 years. We have had the first convention of the Council of Europe in 1981, that was dealing with the protection of individuals as regards to automatic processing of personal data. Then in 95 we had our own European directive. We have more than 100 countries in the world that have adopted data protection national legislation, and in 2016 we have adopted the GDPR that entered into force on 25th of May last year. What are the main principles embedded in GDPR? If you have followed and complied with the previous directive and the national legislation in your own countries, you won't have much troubles of being compliant under GDPR, because GDPR builds on the principles of the Data Protection Directive. The big difference is that it increases tremendously the transparency and accountability of the data processing activities, meaning that the data controllers and the data processors are fully accountable for all their actions as regards to data processing. This also means that the data protection rights of individuals are extremely enhanced and they're enforceable. In terms of scope and application of GDPR, we have to take into consideration that GDPR covers the processing of personal data of living individuals, which means that if you are doing any research on deceased people, then Sorry? Hello? Can you hear me?
I think probably someone...
Albena, we can hear you very well. There's just someone having the microphone on. Please.
Okay, that's great. So if you're processing personal data of deceased people, then this type of processing does not fall under the scope of the regulation. However, beware if you're doing, for example, genetic research on deceased people, but the aim of your research is actually identifying their relatives and people related to them. So you're looking at not only deceased people, but also living individuals, then immediately your research falls under the scope of GDPR. GDPR is applicable for all data controllers and processors established in the European Union. But not only this, also non-European data protection data controllers and processors who are processing personal data of data subjects who are in the territory of EU. So we are not talking about only European citizens, but any citizen and any person who is present on the territory of EU. And these non-EU data controllers and processors are offering goods and services to the people that are present in the territory on EU or are monitoring their behavior. Which means that for such kind of activities, GDPR will be applicable also to non-EU data controllers. For research that is conducted outside of EU, in a non-EU country, with participants that are not present on the territory of EU, but is funded under Horizon 2020, GDPR won't be applicable, but the ethics standards established under Horizon 2020 and all the requirements related to data processing and ethics will be still applicable. So what is personal data? There is no big deviation from the definition that was contained into the directive. Personal data is any information relating to an identified or identifiable directly or indirectly natural person. We should, of course, not forget that this is not only the name, the identification number, or the tissue of the person. We're talking also about online identifiers like IP addresses, cookies, IDs, and any or factor that can link us to a psychological, physiological, genetic, mental, economic, cultural, or social identity of the individual. So if we are conducting research where we have a smart fridge that sends data to the cloud, the data from the fridge, which can reveal that I'm, for example, eating too much red meat, and this can be identifier for my health conditions, will be considered most likely, depending on the context, health data, and will have to be handled in a appropriate manner. When we are talking about processing of personal data, we are talking about any operation that relates to data. On the slide, you see the definition that refers to collection, recording, organization, structuring, dissemination, and etc. In a very brief definition and simplified form, every time you touch data, every time you look at data, you're processing data. And this of course requires you to follow GDPR requirements. Some categories of data merit special protection because they are considered especially sensitive. Under the previous directive, we were talking about sensitive data. Under GDPR, we are talking about special categories of personal data, and this includes genetic biometric data, data concerning health, or sex life or sexual orientation of the person, but also it includes any type of data revealing racial or ethnic origin, political opinion, religious or philosophical belief, trade union membership. If you're processing any of these categories of data, you have to be extra cautious, and under GDPR you will have a special obligation to protect the rights and freedoms of the individuals, because the processing of such data can expose them on higher risks than the processing of any other type of data. Anonymization is a key concept under GDPR because fully anonymized data does not fall under the scope of GDPR. Anonymization is, in other words, a process of ensuring that the risk of somebody to be identified is negligible. When we are talking about anonymization, we are talking about anonymization techniques that are available today. Both the legislator and we are aware that full anonymization is extremely difficult, and given the rapid development of new technologies, what is considered anonymized data sets today may not be fully anonymized in 5 years' time. When you are determining whether the data set is anonymized or not, you have to take into consideration the available resources and technologies today, and the reasonable effort that may take to somebody to de-identify or link the anonymized data to an individual. Of course, this will depend very much on the resources and the time that will be needed to re-identify an individual out of a huge anonymized data sets. The second key concept in GDPR is pseudonymization. Pseudonymization and pseudonymized data is data where we have removed the obvious identifier, such as names, and we have replaced them with indirect identifiers, such as numbers. And we keep these two data sets separately, where the indirect identifiers are held in a separate database, and the so-called key that can link the indirect with the direct identifier is protected. Pseudonymized data is, however, data about identifiable individuals, which means that such type of data falls under the scope of GDPR. Since it is extremely easy to link, having the key to link the data to the individual. There is profound confusion in some of the projects what is pseudonymized data and what is anonymized data. Please bear in mind that if you have a key, you are processing pseudonymized data. Also, when you are considering anonymization or pseudonymization, beware that from the moment of the data collection, if you are collecting personal data, until the moment you anonymize the data set, you're processing personal data. The same refers to the moment that you collect personal data and you pseudonymize the data. The risks for the data subject when you're processing data that is not pseudonymized are higher or anonymized than if you pseudonymize. Consent is a key concept in GDPR. It is, however, only one of the 6 legal bases for data processing under GDPR. For research purposes, you can use different legal bases such as public interest or legitimate interest of the data controller. However, consent is key from a research ethics perspective, because we have to adhere to the principles embedded in the Oviedo Convention and Helsinki Declaration, saying that no person should be involved in a research without his or her knowledge. Consent under GDPR is very specific, and it has a couple of key components. It should be freely given, which means that there should not be imbalance between the data controller and the data subject. If I'm collecting data from a patient who went in a hospital for hospitalization, and during the hospitalization I'm asking for his consent to use his personal data for research purposes, and I'm the doctor, there will be a clear imbalance between me as a data controller and the data subject. For example, if I'm a professor who wants to do research with his students, there will be again a clear imbalance between the data controller and the data subject. The same refers if I'm an employer who wants to involve his employees in a particular research, because the chances and the possibilities of the data subject to say no, while they exist in principle, de facto will be very difficult to implement. And then the other determining factor for the free given consent is, can the consent be withdrawn as easy as it is given? And this is a key requirement under GDPR. When we are collecting consent, we have to be very specific on the scope of the consent. For what data processing activities we are collecting the consent and the personal data, what are we going to do with this personal data, and how we are going to protect the data subject rights. Under GDPR, there are a number of research derogations which allow the researchers to not to adhere to the requirement of specific consent, but ask for a broad consent of the research participants. This is possible in cases where at the beginning of the research it is not possible to identify all the data processing operations and the full scope of the data processing operation. In this case, the research participants should be given the possibility to opt in or opt out of certain areas or parts of the research. The good practice that is embedded in the and is very clearly described in the EU Handbook on Data Protection Law that was issued last year suggests that in cases where you are not exactly clear on all the data processing operations you intend to do within the scope of your research, you have to inform your research participants about the different stages of your research, what you intend to do, and if possible, during these different stages, inform your research participants on how your research develops. And in all cases, you have to adhere to the ethics standards established for medical research. The consent should be also given and written, the information sheet form should be written in a very plain language which is intelligible and it is clearly distinguishable from other issues. When we are conducting research with humans, we always have to have informed consent form for the participation of humans. If you decide, and information sheet of course, if you decide to combine the informed consent for the participation with humans with the informed consent for the data processing, the two issues should be clearly distinguishable from each other. So you'll have to have in your information sheet and consent form a section that is dedicated to your explanation, what you're doing in terms of research participation, what you want your research participants to do, and how are they going to take part of your research. And then a second part that will explain to them how you are processing, for what purposes you're processing their data, and how you're protecting their data from possible leakage or any type of harm that for the individual. And then the consent forms and information sheets should be absolutely clear and ambiguous. They should be able to be read by any individual and be understandable. The same refers, of course, to the information sheet and assent forms if you're involving children in your research. Data minimization is another key principle that should be adhered at all times under GDPR. Personal data should be adequate, relevant, and limited to what is absolutely necessary in relation to the purposes for which they are processed. Which means that while as a researcher, it's very tempting to go to the field and collect as much data as possible and then see what we are going to do with it, that's already not an option. Under GDPR, data should be collected not on the nice-to-know principle, but on the need-to-know principle. And this is an absolute requirement for all Horizon 2020 projects and for all data processing under GDPR. The key approach that GDPR introduces is the risk-based approach. The data protection measures that will be applied should be proportional to the risk to the data subject. I mean, obviously, if you're climbing a mountain, the risks for your safety and health are higher if you're climbing a ladder in your kitchen. The same applies for data processing. In most of the context research, if you want to organize a seminar with experts and you're collecting their email addresses, most likely the risks related to the data processing will be much lower in comparison to the risks that you may expose your research participants if you're collecting and processing their genetic or any type of health-related data. Possible indicators that can flag higher ethics risks are the types of personal data that is used in the research. Obviously, as I said, if you're collecting or processing any type of special categories of data, then there are higher risks for the research participants. The risks are also dependent on the data subjects involved in the research. In any case, when you involve children or any type of vulnerable persons, or in case of research that involves persons who have not given their explicit consent to participate in the research project, meaning that you're not asking for their consent, but you decide to process data based on legitimate or public interest, then the risks of the research participants are higher. The scale and complexity of the data processing is also very much one of the determining factors for a higher ethics risks for the data subjects. In any case, when you're processing large scale of personal data, when you involve multiple data sets or service providers, when you're doing big data analytics, or you're monitoring systematically publicly accessible areas on large scale, this entails potentially higher ethics risks in case of data breach. The data collection and processing techniques involved in the research are also key determinator. There are some data processing methods that are more privacy intrusive than others. A typical example is covert research, surveillance, tracking, or deception of individuals. Data mining, web crawling, social network analysis are considered extremely privacy intrusive methods. The same with profiling of individuals or group, use of any type of artificial intelligence to achieve and analyze personal data, or the use of automatic decision making that can result in significant impact on the data subject. And then the last indicator is the involvement of non-EU countries, that may entail transfer of personal data to non-EU countries which are not offering adequate protection for the data subject rights of the individuals. The indicators that you see in the screens are further explained in the guidance note on ethics and data protection that we published for Horizon 2020 beneficiaries and applicants last year in November, and you can find it on the participant portal. Data protection impact assessment is a new element introduced by GDPR. Data protection impact assessment should be conducted under Article 35, where the type of processing, in particular when you're using new technologies, can result in high risk to the rights and freedoms of the natural persons. In this case, you have to conduct data protection impact assessment, which means that, in a very simple terms, you have to do a data mapping. You have to understand what type of data are you collecting, why you're collecting this type of data, where do you store. You have to map all the processes related to the data processing. You have to assess the risks for the data subject, and you have to elaborate a mitigation plan on how to decrease and minimize the possibility for your data processing activities to expose the data subjects to higher risks. As I said, GDPR enables research by including a number of derogations. First, processing of sensitive data for research purposes is allowed, which is not the case for any type of data processing, where the general principle is that the processing of personal data of special categories of personal data is prohibited with few exceptions, and the research is one of them. The basic principle embedded in Article 89, which deals with the research exceptions and how they are applicable, states that in case you can reach your research objectives by using anonymized data sets, then you should anonymize. This is your first question to ask yourself. Can I reach my research objectives by processing anonymized data? If I'm conducting research on a provision of quality of medical provision in hospitals throughout Europe or throughout the world, then maybe I don't need the personal data of the patients that I'm asking to participate. It's a very obvious example. In case your research objectives cannot be reached by using fully anonymized data, then you have to pseudonymize. And this is the second basic principle. And then only in the cases where you can't reach your research objectives by using anonymized or pseudonymized data set, this is the only case where you can process personal data in a raw format. So whenever you are applying for H2020 projects, please do consider the first level, can you anonymize? The second level, can you pseudonymize? And then continue with your research proposal. Data minimization principle should be applied at all times. And this is key irrespectively of if you're processing data for research purposes or for non-research purposes. And this is one of the main requirements of the ethics experts when they're looking at the projects from a data protection perspective. Are you collecting excessive amount of data or not? And sometimes it's extremely difficult because it's not only collecting data while on the field, but also a very simple example is excessive amount of data in your consent forms. We have seen consent forms that are asking the individuals not only to sign and give their names, but also their email addresses, their date of birth, their town of birth, their social security number. Obviously, you don't need to collect all this data to justify and to show that a person has agreed to take part in a research. What is very untypical for any type of EU regulation, but it's very typical for GDPR, is that GDPR enables the member states to adopt a number of provisions and to adopt national implementing acts. This nice colorful graph that you see is not meant that you read it, but these are all the articles under GDPR that enable the member states to adopt different standards and different limitations under the general provision of GDPR, which means that apart from complying with GDPR, you'll have to comply with the national legislation established in the country where data is collected. As refers to genetic, biometric, and health-related data, member states may adopt special derogations or limitations related to the processing of such categories of data and to the data subject rights, which means that in any type of research that involves genetic, biometric, or health-related data, you'll have to check the national legislation of the country where the data is collected and also consider if there are any limitations to the transfer of data even within the European Union, because the law in France may differ from the law of Germany, for example. The key data protection principle and ethics principle under GDPR is that the data processing should be lawful, fair, and transparent for the research participants. The ethics review process focuses on the concept of fairness and transparency, And as I told you, while you may have different legal bases that will ensure the lawfulness of the data processing, in the ethics review for Horizon 2020 project, you have to, and in general under GDPR, you have to establish and to explain how you adhere to the principle of fairness of data processing, how you ensure that your research participants are aware that they are part of a research project, and how they can opt out if they wish so from your research. The main ethics concerns that we see are recurrent in H2020 applications and in H2020 funded projects are the following. The first relates to the how free, voluntary, and informed consent that you have collected is. This is particularly difficult if you're conducting research involving health trackers, for example, or fitness trackers, and to what extent you can demonstrate that no person is involved in a research without his or her knowledge. The utilization of publicly available data is also of a great ethics concern, because we see in very many cases the misconception between the concepts of being in public and the concept of being public. When we are on Twitter and we post our public opinion, we like to be followed by as many people as possible, and that is considered very good, normal. If we are followed by people, the same amount of people on the street, or even by one person, that is considered creepy. So when in very many cases, we have research saying, yeah, well, I can scrap social media platforms because the data is there. So it is public. We have to consider the reasonable expectations of the data subject that have posted the data there. People treat the internet and social media platforms the same way they treat the pub or the restaurant. When we go with friends to a pub or a restaurant, the conversation that we are having between us remains private. We are in a public space, but our conversations are private. People treat in the same way social media platforms. So it is not enough that the researcher can see the data. The researcher should also demonstrate that there are no reasonable expectations from the data subject that this data should not be used for any type of purposes. So the researcher should demonstrate that this data is actually open data. There was a very infamous ethical scandal a couple of years ago related to a Danish researcher who did a psychological analysis of the users of a dating platform called OkCupid. What the researcher did was scraping all the data from the accounts of the users, and this data was concerning highly sensitive and private issues as their sexual preferences, drug abuses, and etc. What the researcher did, he compiled all this data and put it in an open on internet under the slogan, "This is an open, it's an open data, and researchers should benefit from it." Obviously, while the names of the users of the platform were not there, their IDs were also there, and the possibilities for linking the data that was openly published on internet to an individual were very high and basically very easy to do with a person who was not even very highly tech-oriented. Obviously, there is a huge ethical problem with this, and we can't rely on the slogan of under open data and open science to hurt and potentially harm our research participants who are, on the top of it, not aware that they are research participants. Another ethics concern relates to online recruitment of individuals, because while online recruitment allows us to reach as many individuals as possible, and this applies in particular to research involving children, in the online sphere, we actually don't know what are the real age of our research participants. A typical example how things can go wrong is a research involving aiming to identify why people hurt each other and kill themselves. We had a project which wanted to post an online survey on internet with the only safeguard asking the participants to say that they are above 18 years of age. This online survey was targeted at people who have suicidal thoughts and people who want to hurt themselves, not providing any type of psychological support afterwards. You can imagine that this is highly ethically problematic because we don't know the amount of people who actually were underage, and the possibility for such underage people to take part of research, and the research methodology actually harming them both psychologically and physically. The other ethics issues that we see very often in research projects and research proposal is the genuine confusion between anonymization and pseudonymization processes. Very often we get statements saying, I'm not processing any personal data, I'm not collecting any names, I'm only geolocating people. Geolocation data is obviously personal data, and this is a highly intrusive method of data processing. While we are aware that researchers are not data protection experts, and such confusion is can be very well justified, what we do expect is from all our researchers to contact and get the advice of their institutional data protection officers from the very outset of their research, and the data protection officer in the institution will be able to advise what type of data is anonymized and what type of data is pseudonymized, and what will be the measures that should be set in place in order to protect the data subject rights of the individuals involved. Data minimization and excessive collection of data, as I told you, along with excessive storage periods, are also a very common ethics concern that we see in our project. Apart from the excessive amount of data that some projects intend to collect, we see storage periods that may range from 100 years to forever. While there is a specific research derogation allowing the research to store the data for longer periods than it's absolutely needed for the data processing operation, the researcher should be able to justify these longer storage periods. Obviously, if you are doing research on rare diseases and you want to store the data about rare disease patients and tissues or blood samples for longer than your research, then you may probably have a very good justification why you want to do so. But this is not always the case. Also, when you're defining your storage periods, limitation periods, beware that irrespectively of the H2020 funding, you will have to comply with GDPR after the end of the project, meaning that if you want to store your data for 100 years, you'll have to comply with GDPR and you'll subject for sanctions for 100 years. And then, of course, it's your decision if you want to do this or not. Flawed security arrangements and data transfers are another ethic issue that we see quite often. When we are talking about data transfer, we are not talking only about physical transfer of data from one beneficiary to another, but we are also talking about storing data in the cloud and knowing where your cloud provider is based. If you don't know where your cloud provider, for example, is based, and this cloud provider is based in a jurisdiction that does not offer adequate protection for the personal data, then you're exposing your research participants at higher risk. The same relates to the type of software services that you may use. A very classical example was a wonderful research done only in Europe by European beneficiaries, where the researcher was taking images with her personal iPad, sending this data of a highly vulnerable people in the cloud without knowing what are the arrangements of the cloud provider, and then using free of charge analytical software of a software provider based outside of EU in a non-secure jurisdiction. The terms and conditions of this software provider were stating that they can use the personal data for whatever purposes and they can sell the data. Without having the intention to, the European researcher funded under H2020 was exposing the research participants, vulnerable research participants, to tremendous risks, both ethical and physical. So what are our new requirements based on the main and key concepts of GDPR and the main ethics concerns that we have seen in our ethics review process? The first requirement is related to the confirmation that the data protection officer has been appointed in the research institution. Under GDPR, all public bodies should appoint mandatory data protection officer. So if you're a publicly funded research institution, then you will have to appoint institutional data protection officer under Article 37 of GDPR. You'll have to appoint a data protection officer under GDPR also if you're processing sensitive data on a large scale, or if you're systematically monitoring public places on a large scale. The cases where GDPR requires you to appoint, it requires your institution to appoint data protection officer, are listed in Article 37, and there are comprehensive explanation on the guidance on data protection officer that Article 29 Working Party produced last year. So I will heavily recommend you to read the guidance note, and also beware that there are certain GDPR requires that the DPO that is appointed by the institution has certain qualifications. It's not a random person that can be just appointed to be a DPO. In case, and the contacts of the data protection officer should be made available to all your research participants. This is a measure that will guarantee that your research participants, in case they feel that their data subject rights are violated, can complain and can ask for rectification of the data processing operation. In case your institution, research organization, is not required to appoint data protection officer under GDPR, you'll have to submit a fully fledged data protection policy that is specific for the project. Please do not refer us to websites of your institution or to a general data protection policy of your organization. What we want to see in H2020 funded project is how exactly you're going to protect the data subject rights of your research participants that refer to your specific research projects and methodology. If you have to always be able to explain how all the data you intend to process is limited and relevant for the purposes of your research, or how do you comply with the data minimization principle. In case you are a H2020 beneficiary and you have a requirement to explain how you comply with the data minimization principle, this means that the independent ethics expert consider that you are collecting excessive amount of data, and they consider that you are not complying with the data minimization principle. So you have to provide explanation about that. And then you also have to provide an explanation in case you decide not to anonymize or pseudonymize your data sets, why you are not doing so. And you have to explain why the objectives of your research cannot be reached by using anonymized or pseudonymized data set. In case personal data are processed, and this is an old requirement, you have to have, of course, and provide an information sheet and informed consent forms that are suitable for the particular research participants that you're involving. In case personal data is processed, you have to also describe the technical and organizational measures that you will implement to safeguard the data subject rights and freedoms. This is in practice your data protection policy. The data protection policy normally should include the description of your respective anonymization and pseudonymization techniques, and description of the security measures that you are going to implement in order to prevent unauthorized access to personal data or equipment for the data you are processing. You, of course, can include all these measures in your data management plan. So in case you are submitting a data management plan, you don't have to also submit a data protection policy as a separate deliverable. However, at the level of application, you have to be able to demonstrate that you will and you have thought on how you're going to ensure the technical and organizational measures to prevent possible data breaches and possible harm to your research participants. So the best example will be if you include this description of these measures in your application form under the section ethics if you are processing personal data. Also, including this information in the data management plan will not be sufficient if the submission of your data management plan is at month 6, but you are planning to start the collection of data at month 1 of the project. In all these cases, you'll have to submit your data protection policy in advance. In order to facilitate and remind you, there is a specific requirement that refers to the special derogation pertaining to the rights of the data subject and the processing of genetic, biometric, and health-related data, where we remind you that you have to check your national legislation. The good practice will be if you, at the level of application, you have already done such check and you confirm that you are going to comply with the national legislation of the country where the data is processed, apart from GDPR, of course, and any other relevant legislation in this regard. And then, while it is obvious that health-related projects will process sensitive personal data, in case you're processing other type of categories of personal sensitive data that are not obvious, there is no obvious justification on why you do so, you'll have to provide such justification. In case you're processing previously collected data You have to provide us with details on what exactly type of data you're processing and what is the database that you use. What is the source of data? Then you have to confirm that you have a lawful basis for the data processing, and again, describe the appropriate technical and organizational measures set in place to safeguard the rights of the data subject. And this is something that your data protection officer will help you with, of course. And then you have to provide us with the permission of the owner, manager of the datasets. If, for example, we are talking about social media datasets or biobanks or any type of data. We have to be sure that you're not just scrapping and using data that the owner of the datasets and the owners of the data have not intended for the purposes of your research. In case the research involves public processing of publicly available data, then you have to confirm and explain us that this data is publicly available and it's actually open data that can be freely used for the research project, and provide, if necessary, permission of the owner or the manager of the datasets. Again, this refers in very many cases to social media datasets. If you're planning to transfer data from EU to a non-EU country that is not covered by adequacy decision, then you have to provide details on the type of data that you're intending to transfer, and you also have to confirm that such type of transfers are in accordance with Chapter 5 of GDPR, and this is again something that your data protection officer will help you with. For certain number of countries, the Commission has granted an adequacy decision, meaning that the data processing and the data protection measures established in these countries is considered equal to the European one. These countries are established and are listed in the website of DigiJust, and they include Norway, Liechtenstein, Andorra, Argentina, Israel, New Zealand, recently Japan. Beware that when we are talking about transfer to the states, the adequacy decision covers, or the so-called privacy shield, covers only commercial organizations that must be self-certified under privacy shield and must be subject to the scrutiny of the Federal Trade Commission, which means that for any other type of organizations, you have to check Chapter 5 of GDPR and establish if you have a specific safeguard or specific legal base for the data transfers. And again, it's not only when you transfer data to a recipient, but this also refers if you are using a service providers that are not situated in Europe and in the countries covered by adequacy decision. In case you're transferring personal data from non-EU country to EU or other third country, apart from a provision of details on the data that will be imported to EU, you have to confirm that such transfers comply with the laws of the country where data is collected. Some countries worldwide have a special legislation that prohibits the transfer of certain categories of data outside of the country, and we have to make sure that you are not violating the law and smuggling data from a non-EU country to EU. In case your research involves profiling, which is again considered a highly privacy intrusive method, you have to provide us details with the methods you use for profiling, and you have to provide an explanation how the data subjects will be informed of the existing of the profiling, because GDPR establishes a special and additional rights for the data subject that can refuse to be subject to profiling. So you can't just decide that you are going to profile people without their knowledge. You have to explain how you are going to explain to your data subject the possible consequences that may follow out of the profiling and how their fundamental rights will be safeguarded. This all should be explained either in a separate section in your ethics description in the application procedure or in your data protection policy at a further stage, and it has to be extremely well and clearly spelled out. For other type of intrusive data processing methods, you'll have to provide us such as tracking, surveillance, audio or video recording, geolocation tracking, and etc. You have to provide us also with the details of the methods that you will use for tracking, surveillance, or observation, and explain how the possible harms for the data subject's rights will be prevented, and the data subject rights will be safeguarded. In cases where your research involves profiling, systematic monitoring of individuals on a large scale, processing of special categories of data on a large scale, any type of intrusive methods of data processing and collection, you may be required to conduct and evaluate the ethics risks related to the data processing activities of the project. This evaluation will also include an opinion if data protection impact assessment should be conducted under Article 35 of GDPR. Beware that as a beneficiary, if you have such a requirement, it is not sufficient to write an explanation why you as a data controller consider that you should not conduct data protection impact assessment under Article 35 of GDPR. In any case, you'll have to evaluate if requested to do so, and it is a good practice if your research covers any of the intrusive methods of data processing that I already mentioned, to evaluate from the very onset the ethics risks related to the data processing. These ethics risks and the ethics assessment of the risks goes beyond the GPA that you may be required under GDPR. There you'll have to not only assess the individual ethics harms for your research participants, but you will also have to look at the potential ethics harms to third parties. For example, family and friends. If you're doing genetic research, how can this research, for example, influence the family members of your research participants in case of data breach or data leakage? And you'll also have to consider the possible group-level ethics harms. Even in this case, when you're using a large anonymized data sets, certain objectives of certain type of research can be ethically problematic. And for example, if the aim of your research is to link a particular disease with a particular ethnical group, or a minority group, or particular link intelligence with nationality, for example, you may potentially cause harms to individuals that have never taken part of your research, and you may stigmatize entire groups of population. The potential ethics risks that you may and you should consider are obvious discrimination and stigmatization, exposing the identity and sensitive data of your research participants, security, safety, and safety risk for the data subjects, which from a simple decision where you store your data, for example, the storage of a highly sensitive data in a non-secure location can expose your research participants to safety and risk for their life including, but you also can expose your research participants to reputational risk or loss of position and occupation. So all this possible risk, along with the possible misuse of data, if it gets into the wrong hands, should be reflected in your ethics assessment of the risks related to the data processing, which again is and may be different from the data protection impact assessment under GDPR. For further help, we highly encourage you to read the updated guidance on how to complete your ethics self-assessment. The guidance was again updated this year in February, and in the section Ethics and Data Protection you have a very clear list, a table which basically asks the question and explains you what type of information and what type of deliverables or documents you have to provide when applying for H2020 funding. This guidance should be used also by current beneficiaries who will help them explain and understand better what are the current ethics requirements. The guidance note on ethics and data protection that we published last year, and it's available on the participant portal, should be your second point after the how to complete your ethics assessment of reference. And in case you have still questions related to ethics and data protection of your particular project or application that you can't answer, and they can be answered by your institutional data protection officer, we will be always happy to help, and you can ask and write questions to our ethics help desk that you see on the screen. Please be aware that we are not going to interpret GDPR for you. We can't determine your legal basis or the safeguards for data transfer. We will be extremely happy to help you with dealing with your ethics requirements in relation to data protection or any other issues embedded into how to complete your ethics self-assessment. With this, I will be happy to answer any questions. I see that there are quite some.
Yes, there are quite a lot of questions. Thanks for this great presentation, Albina. I would say I will simply read out the question and you can answer. And I think we have about 12 minutes and we will see how far we can get. So can an EU Horizon 2020 project be a data controller? If so, how could the project enter into the data sharing agreements if it cannot enter into legally binding contracts?
So first, again, I'm not going to provide, even if I wish to do so, we can't provide a legal help and legal advice. Obviously, H2020 Consortium is not a legal entity, so each of the participants in the consortium will be separate data controllers or co-controllers or joint controllers and data processors, and this should be who is acting in what category should be determined by the data protection officer of the institution.
Thank you. And if the EU project receives data and the key or lookup table is kept in a separate database to which the project does not have access, is the data anonymized for our purposes? That is, if the EU project has no access to the lookup table or key.
Yeah, that's a big discussion in the data protection and privacy expert community. If the EU project, and this is my personal opinion, because there is, again, as I said, discussion, if the project receives a data set that they cannot link to any individual while putting reasonable efforts, then normally this should be considered anonymized data.
Okay. I am not sure to understand, a participant says, why in Horizon 2020 project the consent will be a key element. The Oviedo Convention only applies to interventions in the health field. Therefore, other legal justifications should also be taken into account in Horizon 2020 projects, in my view. That's more of a comment.
So, as I said, the H2020 applicants or beneficiaries can choose their legal basis. They can very well choose to use public interest or legitimate interest as a legitimate base for data processing, as long as they can explain to us how this data processing is fair to the research participants. And while it's true that Oviedo and Helsinki, they cover health-related research, medical research, the foundations of the modern research ethics come unfortunately from the atrocities that happened during the Second World War, and the main principle, and also embedded in the European Charter of Human Rights and the EU treaties, said that data protection and privacy of individual is a key right. So the right to research is not an absolute right that can override the rights of the individuals about privacy of life, personal life, and family. So as far as the applicant or the beneficiary can justify and explain us the fairness of the data processing, it will be fine.
Okay. If a consent is given by a data subject to a certain area of research, can this personal data be just for all areas of research if it is being anonymized?
If you're dealing with anonymized, so if the consent is given before the anonymization, you mean, and then afterwards the data is anonymized? So
Exactly,
it is so if the minute the data is anonymized, it falls out of the scope of GDPR. So when the data it cannot be linked to any identifiable individual, this data can be used for any type of purposes. Of course, it will be a good practice if in the consent form it is the research participant has agreed the anonymized data to be used for whatever purposes, but normally the minute it becomes anonymized, it falls out of the scope of GDPR. And in terms of ethics concerns, our concerns will be only if the anonymized data sets are used for type of research that can potentially stigmatize or discriminate entire sets of populations.
Okay. Another question is, I'm not sure I understand it, maybe you can deal with it better. Is the nice to know principle not acceptable if research participants consent to it?
So you have to, the nice to know principle, you have to explain data minimization should be applied in all cases. And this is requirement of GDPR. If the research participants agree that you are collecting data for further research with unspecified purpose, then this goes already in the area of blank consent. And while while GDPR allows broad consent for research purposes, the statements like "I agree to my data to be used for research purposes" are considered invalid from a consent purpose, and this is explicit guidance of Article 29 Working Party on transparency and on consent.
Thank you. Another question. Data should be reusable and results verifiable. Can this be integrated in the informed consent? Does this contradict the consent for a given study without any later follow-up studies?
So my question will be, what will be the reasons for, yes, the research results should be verifiable, and this is obviously very important. The question is why we will need a personal data, why we will, in case we don't have any incidental findings policies or any type of need to go back to the individual, why we will need to keep personal or pseudonymized data sets. You can verify results normally with anonymized data sets as well, unless, of course, we have a very context-specific research. And in this case, the answer will be it depends.
Okay, thank you. Next question. Need to know versus nice to know. When doing big data analysis, it is hard to know in advance what is needed to know. How to deal with that?
It will be, we realize that, and big data analytics are extremely useful for research purposes, and we also realize that it will be very context specific on the type of research, the type of objectives of the research, and the methods used. So it's difficult to, you have to give me an example on specific research so that I can analyze it. The answer will be always, it depends, and it will be highly advisable for the researcher to contact their data protection officer in the respective institution.
Okay, thank you. Are old people considered vulnerable people in this context?
Well, I mean, we don't have vulnerability is also very context dependent. Old people can be very able to give their informed consent to participate in a research project. What we will have to determine is if an elderly people are giving their informed consent with a project that involves artificial intelligence, big data analytics, and etc., social media crawling, if they are fully aware of the impact of the research methodology on them and on third parties. But elderly people are not vulnerable population by default. It depends on the context of the research. I mean, I can be absolutely able to give informed consent, but the minute I'm in a hospital and I'm subject to surgery or any type of medical intervention, I may become a vulnerable population. So that's also very context dependent.
Mm-hmm. Yeah. Another question was, when shall the impact assessment be applied?
The impact assessment you should do in the very beginning of, before, actually you should, the minute you start devising your research methodology that involves data processing, you have to consider all the possible risks and all the data that you are collecting. This is why it is a very good practice if you go and consult your data protection officer, not when you have already written your research proposal, but while writing it and while considering the different methods of research, because it may turn out that you have written your application and then from a data protection point of view you have included methods that are not acceptable, and then you'll have to rewrite your methodology. So this is why it is good to go and seek the advice of the data protection officer when you already have an idea what type of research you are doing and how you want to do it, and discuss it with the data protection officer. And this is the moment when, if your data processing may result in a high risk for the data subjects, to do a very good mapping of all the data types and the data processing and the mitigation measures, because you have to include them in your application form.
Mm-hmm. Thank you. Albina, is there time for more questions? I know you have another appointment.
No, it's we can continue for another 10 minutes because I see that there are a lot of questions coming.
Okay, perfect. Thank you very much. So, will failure to comply with the national legislation be considered a breach of GDPR in addition to breach of the national legislation?
I mean, most probably that will be a decision of the National Data Protection Authority. I would not risk it.
Okay. Data anonymization is recommended. However, subject must be able to withdraw from the project at any time. How can these contradictory processes be achieved?
So the minute data is anonymized, there are no risks. The whole point of GDPR is the protection of the human rights and freedoms of the individual. The moment the data is anonymized irreversibly, then there are no risks for the data subject rights. The possibility to withdraw from research enables the research participants to minimize the risks for himself or for any other third party. So if the data is anonymized, the risks are minimized as well. Obviously, we are not going to keep personal data just for the sake of if somebody wants to withdraw from a research in 10 years' time. The basic principle, again, of GDPR is protection of human rights and freedoms. So if there is no risk for the data subject, then, which is in the case, in most of the cases with anonymized data set, then it's fine from an ethics perspective.
In retrospective chart reviews regarding hospital-based electronic medical records, is patient's consent necessary in cases where the research protocol has already been approved by the ethics committee of the hospital?
So it depends. Was it approved before GDPR or after GDPR enters into force?
So I think
in case this will fall under the processing of previously collected data, and in this case you'll have to have a legal base. Further processing of previously collected data is considered compatible under GDPR. In this case, you'll have to confirm to us that you have a legal basis for such processing and that the data subject rights won't be violated.
Creating a list of professional experts in a research area just by including public data from the respective institutions of those researchers. Does this need to involve any type of data protection regulations?
Well, normally, if this data is manifestly, although this is personal data, when the data is made public by the researchers themselves, this will be a data processing that involves minimal risks. So it won't be highly problematic from an ethics perspective. Unless you are creating first the list, then you start creating profiles based on their tweets, for example. And then the profiling will be the part that is problematic from an ethics perspective. I mean, that measure should be applied. But this goes back to the risk-based approach, meaning that the data protection measures should be appropriate to the risks. In this case, the risks will be very low.
Okay. Next question. As the technology evolves, what today is considered anonymized data could be re-identified in 5 to 10 years. Does this imply any kind of responsibility for the researcher who opened this data as anonymized?
GDPR is very explicit on what is considered anonymized data, and the level of anonymization should be considered at today's point. We can't predict how the technology will evolve in 5 years' time. You have to anonymize using all the reasonable and available technical means to make the data unlinkable to an individual today.
And next question asks, how does one treat data that has been collected ages ago, before GDPR?
So it depends. It depends on if you were the person, the institution, you're the data controller who have collected the data, or you're processing a data set that was collected by somebody else. Under the information provision obligations of GDPR, if data was collected by one data controller and then is further processed by another data controller for research purposes, the research organizations do not have the obligations to inform the data subjects if this proves impossible or renders to be very difficult. In case you are the first data controller, however, the obligation to inform still exists under GDPR. And in this case, if you're the hospital which collected the data at the first place and then you want to use it, you may have obligations under GDPR to inform the data subjects. But if you're doing further processing for research purposes, then and you're not the party which collected the data, then you have a specific research derogation.
Thank you. Is research authorization required from the DPO parallel to the Research Ethics Committee?
Normally, in most of the countries, the research ethics committees are not giving authorizations for data processing. I mean, UK is a notable exception. Out of this, in most of the countries, the research ethics committees will not authorize data processing. Under the previous directive, the processing of special categories of data and certain data processing activities required notification or authorization from the national data protection authorities. This is no any longer subject the case under GDPR. In most of the cases, such notifications and authorizations are not needed. However, the opinion of the data protection officer or the ethics committee will establish additional safeguard for the researcher and for the data controller that the data processing complies with GDPR and with ethics.
There is a comment. In my opinion, the European Commission should require specific accreditation of research ethics committees to be able to participate in projects funded by it. We researchers are limited by the lack of knowledge and experience of these committees in all these issues.
Okay, that's a tough one. I mean, freedom of research, obviously, the European Commission cannot establish a mandatory certification for the national ethics committees established in the member states. We do realize that the ethics committees have to deal with entirely new risks. And while the bioethics committees, for example, were traditionally established to deal with very tangible risks, harms to a particular research participant, in the data processing, AI, big data research, and etc., the risks are mostly intangible. We therefore work a lot with national ethics committees on raising awareness, also encouraging the inclusion of data scientists or data protection experts with ethics expertise to help and support the national the national ethics committees, and it's a path to go, but we are doing our best to raise the awareness. The same way we work with the national contact points, we work with the national ethics committees.
Okay, thank you. I think we're now at 12 o'clock.
Yep.
So we reached the end of the webinar. I'm sorry for all the questions we couldn't go through, but like Albina said, there's the ethics help desk you can contact also to approach it with your questions. Albina, thank you very, very much for this great presentation. Yeah, and all the best. And thanks to all the participants for being here today. Thank you.
Thank you very much. Again, we will be very happy to answer all your ethics and data protection related questions and all your ethics questions related to Horizon 2020 project. Again, if the question is GDPR related, your first point of contact should be your data protection officer. Thanks a lot, and always happy to help. Have a nice day.
You too. Bye.
Bye.